Hello, everyone, and welcome back to the UB Medicine podcast. I'm Dr. Allison Brashear, Dean of the Jacobs School of Medicine and Biomedical Sciences and Vice President for Health Sciences at the University at Buffalo. Today, we're discussing one of the most talked about topics in medicine: obesity, metabolic health, and the emergence of the GLP-1 medications. Over the last several years, these medications have transformed public conversations about weight loss and obesity treatment. They've generated enormous interest among patients and providers and researchers alike. And beyond the headlines, there's really a much deeper story about metabolic health and my own role as a neurologist, how that impacts the brain, how metabolic health impacts chronic disease, and really how the science of our bodies regulate appetite, energy balance, and weight. At the Jacobs School, our faculty are helping advance the understanding and treatment of obesity, diabetes, and metabolic disease while educating the next generation of health professionals. Today, we'll explore what these medications are, how they work, who may benefit from them, and what the future may hold for obesity treatment and metabolic care. Joining me today is Dr. A.J. Chowdhury, Professor of Medicine in the Division of Endocrinology and Diabetes and Metabolism at the Jacobs School of Medicine and Biomedical Sciences. Dr. Chowdhury is an internationally recognized expert in diabetes, obesity, and metabolic disease, and has spent much of his career studying how these advances in treatment can improve patient outcomes. We're also joined by Dr. Kathy Bettine. She's a clinical professor of pediatrics at the Jacobs School of Medicine, Vice Chair of Clinical Affairs for UBMD Outpatient Pediatrics, and an attending physician in pediatric endocrinology and diabetes at the Golisano Children's Hospital of Buffalo. Dr. Bettine specializes in endocrine and metabolic disorders affecting children and adolescents, and she brings an important perspective on obesity and metabolic health across the lifespan. Thank you both for being here. Let's just start with the really big picture to set the stage for our conversation. For years, obesity was often viewed as a lifestyle issue. How is our understanding of obesity evolved, and why is this so important to recognize obesity as a chronic disease?
Yeah, I think that's a very interesting point that you bring up, that we really need to think about obesity not just as an appearance or a body weight problem. It's really a health issue, because it does increase the risk of chronic diseases. So I'm glad that eventually now we are thinking about it as a chronic disease rather than just a lifestyle problem. Just like we wouldn't think about treating hypertension or asthma, just by changing lifestyle, but with some medications along with some of the lifestyle changes. So I'm glad that we have reached that stage now.
That's quite a bit different from when people trained just not so long ago. And Kathy, as we think about children and the impact of what happens in early childhood and the impact that happens when they're adult and older adult, how has that changed?
So we are seeing a lot more obesity in children and unfortunately a lot more type 2 diabetes. We are also finding some of the kids do have genetic changes that could be responsible for excess weight gain.
That is interesting. So you mentioned genetic, then there's biological, environmental factors all playing into both children and adults. Do we have genes impacting this both in children and adults?
Yeah, so as far as genetics are concerned, what we understand is that, genetics do decide, what our body weight should be, what is the amount of food that we should generally be eating and the energy that we should be expending. And so there are some genetic, we have identified genes that can affect our perception as far as hunger is concerned and also energy metabolism. But then the environment does play a role, because it's possible that because of your genes, you're supposed to be a certain weight. But then because of your environmental influences, the food choices that you make or the environment that you grow up in, or because of stress factors, you could then gain more weight than you should. So that is the way I look at in terms of genetics and the in interaction, with the environment in obesity.
And Kathy, with children, that environment is really shaped early on. How does that impact the trajectory the children find themselves in?
The children don't really have a choice of what other people are bringing into the home. And there's also the problem that kids are home alone after school, and so they walk to the closest store, which only sells junk food. And
Right, right. And obesity has a stigma that really still exists today. And how does that affect patients seeking treatment? I mean, now we have these drugs. So how has that changed your practice, people coming to want to be treated?
So this is something that is very near and dear to me, having practiced this for 30 years. Seen a lot of patients who, came in really thinking about that, the reason why they are not able to lose weight is because they are not trying hard enough. And then, we didn't really have too many treatment options that could help them along, in spite of understanding that really their own body is not really helping them to lose weight. Yeah, because the body's natural mechanism is to try and preserve weight. Yeah, because if we lose weight, the body's signals go up where it makes you feel more hungry. You adapt by reducing your energy expenditure, etc. So really what the conversation has changed with some of these medications is that now, we can have that conversation, that really don't think about it just as an appearance. You got to really think about it as a health issue. It's chronic, so you need to still follow those nutritional and behavior changes and exercise. And these are medications that are going to help you, to be able to work against the natural responses of the body, which makes you try to, to make you gain weight. So really, removing that stigma that it is not just, a thing about willpower or a character flaw, has really helped this conversation. And I hope more and more people will understand this and, get more help and have that conversation.
That's so important. And I can imagine that for a child who has challenges with weight, that would be a stigma that could stay with them for their life. So how can these new treatments help children?
well, the kids are actually bullied quite a bit. And so they can be quite depressed when they come in. So if we could get the medication for the kids, which is another issue, it would be helpful along with lifestyle changes.
So let's just jump in here and talk about these medications, the GLP-1 medications that have gone from relatively being unknown to being common everyday words. For the listeners who aren't familiar with the science, what exactly do these medications do and how do they work?
The GLP-1s, these are a class of molecules which we call incretin molecules. So these are gut hormones that are usually secreted. So as soon as we eat, these gut hormones are secreted by the gut. And their purpose is that, it slows down gastric emptying, it suppresses appetite, and also increases the secretion of insulin as glucose levels are going up. Now, what we understand that both in diabetes and in people who are overweight, the effects, there is a resistance to the effect of these medications. So now you can understand that if there's going to be a resistance, even though these GLP-1s are being secreted by the gut, it is not as effective in suppressing appetite or making the body secrete insulin. So then, because of that, you can develop higher blood sugars, i.e. diabetes, and also, you will have a tendency of gaining weight. So with the modifications with pharmacological modifications, what we now do is that with these medications, we achieve what we call higher than physiological doses. So higher than what the body normally produces to be able to overcome, the resistance, the natural resistance that is there. And then that allows the body to be able to regulate blood glucose better. And it also suppresses appetite, so that people can lose weight. And I just want to kind of say that, these molecules were initially discovered primarily to treat diabetes. And then, because of its appetite losing effect, they are very effective now also for weight loss.
How interesting. I did not know. Was that in adult or children?
So this was an adult. So, it was discovered because, there's a lizard called the Gila monster that can survive without eating anything. And I remember I was at the Endocrine Society and somebody was presenting, data that it's from the saliva of the Gila monster that they discovered this molecule that is called exendin. And when they, looked at the effects of exendin in animal models, they showed that it could regulate blood sugar and also suppress appetite.
So interesting. And have these medications, Kathy, been used in children?
Yes. We started with using it in children with type 2 diabetes. And when we can get it for kids that have general obesity, we use it. And then some of the genetic mutations, we've been able to use it in the kids too.
Why do you think that these medications have just taken off and are so commonly used? Every time we turn on the TV, there's something about these medications. Any ideas?
Really what these medications have done is that, so again, having done 30 years, treating people with diabetes and weight, the previous treatments really, used to make people lose 3 to 5%, of their body weight. And yes, that was important from the metabolic aspects of it. But with all the side effects and the way that you had to take that medication, I never really felt whether, I would really be providing benefit to some patients. Now, these medications now are making people lose anywhere from 15% of their baseline body weight. So for somebody who weighs 250 pounds, they could lose 35 pounds on an average. Some other medications, they are making people lose 20% of their body weight. So if somebody who's 250 pounds could lose 50 to 55 pounds. And not only is it making a difference in their underlying health conditions, because that is really the most important thing out here. But remember, somebody who's had trouble, losing weight is now able to lose that. That has a tremendous benefit, psychologically, because they suddenly start feeling much more confident, in themselves. Because, previously they are struggling saying, oh, if only I could do this, it's something that I'm not doing that is not allowing me to lose weight, not understanding that it's a chronic disease. There are certain things in the body that don't cooperate with you to make you lose weight. Yep. And then now they are successful. A lot of the times, they are doing the things that they were doing normally, but not losing weight. And now they are doing the same thing, but now they are losing weight because the body is cooperating with them in terms of. So it's been tremendous. And it's been fascinating for me to see patients come in, overjoyed. So it's really a treat to see, the kind of the smile on their faces and the positivity when they walk in, when they see the effects of these medications.
Wow, I can imagine as a physician, as you said, who's been treating individuals for over 30 years, and Kathy, you as well. Some of the health benefits must be beyond just blood sugar and the weight loss. I mean, I can just imagine arthritis, stroke, hypertension, et cetera. The list goes on. How do we really articulate those benefits of weight loss? It's a broader, really public policy issue, right? So I don't know, Kathy, you must see this in kids, that their trajectory for health the rest of their life is dramatically different.
Right. I mean, it's hard because you're asking someone to spend $5 or $50 to save 5,000 in 50 years, or so it's hard to get that. And one of the requirements is that they have to have had intensive 6 months of dietary counseling, like Weight Watchers or Noom or something like that, before they'll even consider covering it. And my viewpoint is the children are our future, and if we make them healthy now, they will be healthy adults rather than very sick adults in the future.
Oh, so well said. What do you both think are some of the common misconceptions about these drugs?
Yeah, so the common misconception is, one is, as I mentioned, that people think about it that it's about appearance and cosmetic, and it's really about health and longevity. The second thing is that people think that they're taking an easy way out, and it's not really taking an easy way out, because you still have to do those, see, all the studies that have been done, they were done when you had to follow nutrition recommendations. So you had a 500 calorie deficit. You had to exercise 30 minutes every day, 5 days a week. You also had behavioral health counseling. So they were successful in that kind of environment. Yeah. And the third misconception that people have is that it's a short-term thing. If you start thinking about obesity as a chronic disease, then people have to understand that take this opportunity while they're on this medication to improve their behavior, to improve their nutrition, carry on with their exercise, and also understand that it's something that will require a long-term treatment. When I speak to people, I've asked them so many times, everybody tells me, oh, yes, I've been able to lose 10 to 20 pounds, but they always regain it back. Yeah. So they have to understand that it's something that is a chronic thing that we will need to have an approach to maintain, long-term weight loss.
So, what are some questions that patients should ask their physicians if they're thinking about these medications?
I really start off when people are, coming to me, especially from the weight point of view. Obviously, I run a diabetes endocrinology center, so a lot of people also have diabetes, along with as far as the weight is concerned. But if they are being referred, primarily for obesity management, I don't like using the word obesity, first of all. So if they're so, obviously, what is their BMI, what is the waist circumference, what are the underlying metabolic conditions that they have, what have they tried before, what are their expectations. These medications have certain side effects and contraindications, so we need to be absolutely sure. And this is why sometimes when I see people getting onto these medications without proper evaluation, I get scared, because you don't know, because these medications do have side effects. So we, and then obviously we set up the expectations about nutrition. So I know that the insurances are recommending certain things, but I think there is a reason for that, because you really need to have long-term success and long-term expectations. So, and they need to be absolutely, they need to tell us about what are the medications, et cetera, that they are using. So that is how we start off. And then, we look at, is there other reasons why they might be gaining weight and not losing weight, and also associated chronic conditions. Yeah, nowadays we do FibroScan to look at, whether the liver is stiff or not, obstructive sleep apnea. We have a metabolic center that we have now with a multidisciplinary approach that we are looking at what are the other medical conditions that people who are overweight or, have a high BMI come in with, and screen for that to provide them with the right approach, a comprehensive approach, which is not just focused just on weight, but health.
That's so important. And Kathy, tell us a little bit about how the conversation is with parents or caregivers of children who have issues with weight management.
So one thing that I think is very important, and this was discovered at UB is the whole family needs to make changes. It doesn't matter what anyone else weighs, the whole family needs to eat healthier. And, you can be thin and still have hypertension and still have diabetes. So everyone needs to eat healthier. You can't expect the kid to live in a house full of potato chips and not eat them all the time.
Yes, yes. I completely understand that. It's such an important point. We only have a little bit of time left. What excites you most about where the science is headed? Kathy, I'll ask you first.
That they're actually combining these drugs with other drugs to be more effective, even, especially for controlling diabetes and helping people to get to the weight that they want. So I'm just excited about the future.
And AJ?
Yeah, I'm say apart, I know we are talking about GLP-1s, but, there are dual incretin agonists, GLP-1 and GIP. There are triple agonists now. We call it the Godzilla.
Oh my goodness.
Which is actually causing 25%, weight loss. We are combining with other mechanisms like, amylin products in terms of, weight. We are developing oral non-peptide molecules, that work on the GLP-1. And the other very exciting thing is that we are actually using an approach to reduce weight by actually increasing muscle mass. Yeah. So I know we think about weight as just, the fat cell. But, if you can increase muscle mass, yeah, that can increase energy expenditure. And there are trials that are going on with certain medications. Because one of the things with the incretin therapy also, the GLP-1s, is that as we lose weight, we are losing muscle. So that's something of concern. But this other approach where we are actually trying to increase muscle mass, and then we are realizing that by increasing muscle mass, you can actually make people lose weight. So it's extremely exciting.
That's really incredible. And you just gave us so much more information about it's just not these one drug, it's a combination. Well, we're almost out of time. So before I conclude, I just want to ask you each one final question. So Kathy, we'll start with you. What is one of the most important messages you hope our listeners take away about obesity and metabolic health and GLP-1 therapies for children?
Well, I think it's the same thing that Dr. Chaudhry said, is it's not really about how you look, it's about your health. And I actually always tell the kids that they have a little bit of extra weight for their height, because I don't like the word obesity either. It's very negative.
Oh, true. So, there are three things that I would like the viewers to kind of take away from this. Again, one is emphasizing it's not about appearance, it's about health. The second is there are now, medications available that can help you to fight body's mechanism that's not allowing you to lose weight. So please take advantage, of this. And the third is just remember that it's not just the medication alone that is going to give you success. It has to be a multidisciplinary approach where the medications are helping you to follow, the nutritional guidelines. You need to exercise and you need to make behavior changes.
So you both mentioned you don't like the word obesity. So help me educate our listeners. How do we refer to this?
See, so we basically characterize this that, this is your BMI. This is your body mass index. The word obesity and overweight still comes in because it's something, but I think we need to really start thinking about, just like we think about blood pressure, we think about blood sugar, it's a value. We have to start thinking about it as body mass index. It's a value.
Got it. Kathy, would you agree with that?
Sort of, except kids' BMIs change as they grow. So I still like to say unhealthy weight versus healthy weight.
Okay. All right. Well, we will try to change our language. And I just want to thank Dr. Chowdhury and Dr. Pateen, both of you, for a really exciting conversation and for sharing your expertise with us and with everybody, our listeners. One of the themes I've heard through our conversation is that unhealthy weight is a complex and chronic disease. It's certainly not a problem with willpower or individual choices. It's a disease of health, and we're trying to refocus on that rather than the number on the scale, for sure. And the downstream effects of getting to a healthy weight on overall your health for your lifespan when it starts with children and adults. I want to thank you both. And here at the Jacobs School of Medicine and Biomedical Sciences, our faculty are continuing to advance research, educate the next generation of physicians, and improve the lives of patients through innovation in clinical care and scientific discovery. I just want to thank you both, and I want to thank our listeners, and I hope you'll continue to join us for the UB Medicine podcast. And until next time, take care.